yes, I'm sorry you went through that. Really, really sorry.
I appreciate it.
Because look, you still remember, and it's going to be with you forever. So I think, as healthcare providers, we have to also acknowledge that everything we do, they may remember forever.
Yeah, I remember your face. I remember everything.
I remember your name, your number.
I remember it. Like, that was very traumatic for me. Hey mamas and everybody else who's watching, welcome to Talk About It Mamas. Very first interview. This, as you can see, is a different type of setting. It's unusual to me. Is it unusual to you?
It is, definitely.
So, but we're gonna go with it. I find that we really need to have this type of conversation. I felt the need to do this interview because I would like for more moms to get to hear from someone that, you know, is in the healthcare field, and just to get, like, you know, different perspective and hopefully educational information for yourself and whoever you might share it with. So we're gonna get started. Today we have
Bianca.
Tell us, Bianca, like, what do you do?
Yes.
And you know, your experience within the healthcare.
Of course.
field.
So I have been a registered nurse for about 4 years now, working in the labor and delivery and postpartum field. I've also have experience in working in an obstetric gynecological clinic. I'm also a doula. I more so offer my doula services for friends and family, but now I'm expanding to others, of course. And I am also in the process of getting my lactation consultant certification. So that's, you know, I'm a student forever, so I like to learn and add on to my certifications. But yeah, that's pretty much it. I'm a maternal health advocate. Maternal health is my passion. I'm not a mother myself, but my soul aligns to maternal health. So.
We need healthcare workers like you.
Thank you.
But listen, I have to give a backstory. You know what I'm gonna say?
No, go for it.
So for those that were asking me if I had a doula, especially with my firstborn, I did. She was my doula.
Yeah.
So the way we met was online.
Yes.
You know, we were both doing a doula course.
Yes.
If I'm not mistaken.
Yes.
And to certify, I think you had to attend a birth.
Correct.
And I was the one. I offered pretty much for her to, like, you know, get the certification. You know, I'm trying to support our own, to be honest. Okay. And this was my first pregnancy. Like I said, I had her as a doula. And I believe the week before or the week of I was gonna give birth,
the hormones took over control.
I cut it off,
which is okay.
And this leads to my question: like, how do you deal with, let's say everything is going good, and then at the end it's just like, no,
change of plan? Honestly, like, well, I'm a woman that believes in God, and I believe that if it has to go that way, it's God's plan. And although I'm a healthcare professional, taking care of women, I'm not the expert in the woman who's dealing with her own experience. So if you felt like at that time you needed to be alone, you didn't need that doula support, that's all. Like, I'm not holding that against anyone, and I'm not holding that against you.
I was gonna ask, like, do you take it personal?
Of course not. I was like, oh, that sucks.
Yeah.
But I completely understood it at that point, at that time, and even now more so, because that was your experience, and it's such an intimate experience. Like, I get it. I get it. You needed to have your own space.
And I do, like, I remember, like, during that time, I was like, the reason why I cut her off was because I was afraid of, like, people seeing me vulnerable, you know, and
that's a big one.
Honestly, after giving birth, it's like you don't even care. You know? So after the birth, I'm being honest, I was like, oh, I wish I had Bianca.
Aww.
Because the first birth did not go as planned.
Yeah.
And I'm like, oh, and he was tired, he was sleeping. I'm like, I wish I had somebody else. But so so that's how we met, everyone. And we're here now.
Years later.
We didn't expect this.
No.
Okay, let's start with my first question is, what drew you to this field?
All right. Honestly, the field of nursing or just the field of maternal health?
Yeah, maternal health.
Okay. Honestly, it all started as, I guess, a preteen when my mom would have to work and I'd have off days, so I'd stay at home. I was a kid that was always on the TV, and there would be programs that would show like Baby at Home, like on TLC, things like that. So I would always watch that, and I was always so fascinated. It wasn't like a graphic show at all, but it was just so beautiful to watch someone preparing for a new life and then going through that process, and then you're in a room with a few people, and then there's an additional person that comes to be.
I remember you telling me that.
Yeah, like I find that so it brings me shivers every time I really think about it, and that always stayed with me because I always vocalized wanting to be a teacher. But then when I went into CEGEP, which is college around here, I realized that a teacher is not what I want to be. It's not what my purpose is supposed to be. So I looked into midwifery, I looked into nursing, and then I realized I can go into maternal health, into nursing. So that is what I did, and that's what I'm doing.
Interesting. So with that experience of yours, how do you support your patients?
That's a good question. As a nurse, so it depends, right, what role I'm playing. But as a nurse, I absolutely, once I enter a room, obviously I present my title, but I always let them know that they have rights, that they, if anything, they can vocalize and let me know. And I am their personal advocate, like I'm on their team. So everyone is different, right? You can go into a room, you feel the energy's different, and you kind of have to talk to them and build that rapport with them. And that's what I try to do with everyone, especially with the public healthcare system being that we're understaffed and like our time is limited. Hence why I'm not so happy with the field now. But yes, I always offer a listening ear, and depending what phase they are in their journey to motherhood, then we adjust according to what needs to happen. Of course.
And that's you as a nurse?
That's me as a nurse. So me as a doula is different because I have more time on my hands to provide that support and care. And it's really, the tone is so different. And with that, it's really like, what do they need? If I go to, let's say, a client of mine's home and I see like, it's super messy, like I'm not gonna even ask them, like, is it okay if I clean up? Like, I just go ahead, like gradually without them really noticing, and then all of a sudden, they realize that change of space because your environment impacts you, and they have trouble with breastfeeding, like I'm there to support. I'm not a person that likes to overstep my ground. I always try to read the room and read the person and then go from there. So
that's important.
Yeah.
What do you think makes an excellent nurse in labor and delivery and postpartum?
What makes an excellent labor and delivery nurse? Number one, the first word that comes to mind is empathy. You have to be empathetic. Although you can have someone that is a completely different culture, has a completely different belief system than you do, your role as a labor and delivery nurse or a nurse in postpartum care or a maternal health nurse is to support the mom and what she wants to do. Of course, you're there to teach also, because there's sometimes false information out there, and you're there to educate them. But number one is to support them with empathy and being a listening ear, because these are human beings. They look at you, they listen to you, and some of them look up to you, and they can read when you're not interested. They can read the judgment off your face. Like, it's so important to just be present. And if you're not having a good day, because we all have bad days, you can vocalize that to the nurse, to the patient, to your client. Like, I'm not having a tough day. I hope I'm not rubbing off wrongly onto you. You don't have to tell them the details, but I think it's important to be transparent with who you're taking care of, especially if your life is affecting your care. Because you never want that mom to feel guilty. You never want that mom to feel less than. And I think that's really important across all professions, taking care of families and mothers.
It's crazy you mentioned that, because with my last one, like hearing you said that really just brought some emotion, because I literally experienced a nurse during postpartum like, I don't know, she didn't have a great shift from what I've seen. So she came in and she was like, oh, I need to do the test where, like, I think it's jaundice.
Was it the heel prick?
The heel.
Yeah, usually like newborn screening or jaundice tests. Yeah.
So
if
she
it was
came
a blood
in.
test.
She was like, oh, I need to do this test. And with my first son, okay, they did it in front of me in the room. They really made me feel comfortable.
Yeah.
It was a great experience with my first boy. With my second, it was really not that great. She came in, she was like, oh, I gotta do this test. And I'm like, okay, but I gotta take the baby away. And I'm like, okay, we're in a different hospital. Okay. And she was like, I'm like, can I come with you? She was like, no, it's just me and the baby that gotta go. And then I'm like, okay. You know, it was literally a couple hours after I gave birth. And then she left with my son, and I'm just sitting there in bed. I'm like, I don't feel right. Like, so I got up, and I left.
Yeah.
Like
I remember you telling me this. Yeah.
I got up and I went to see where she was at, and when I looked, I seen the same nurse that just left with my baby, without my baby, and I'm like, what is this? So I quickly, because I was coming on this way and she was going like this, and this way is towards the elevators, and I'm like, and then she saw that I caught her and she looked at me. She's like, oh, I feel so bad right now. My Uber came and I had to go get my food, so I gave your baby to another nurse. And I'm just like, you can't be serious. So I went to get my baby and I'm like, no, I'm staying. You're going to do this test with me here.
Yes.
And she was telling me, even in the room, she was like, oh, I'm so sorry. Like, I'm having a bad shift. She was like talking about her son, how calling her son like names that's like, why are you talking about your son like that? Yeah. But all that to say is, like, if you're having a bad shift, I understand it. We're all humans, but nobody told you to be in this field. Like, nobody told you to take care of pregnant women. Yeah. So it's like, you really gotta be self-aware in that field, because now you're affecting me. You made me feel like some type of way because I trusted you. Yeah. And now you give me a reason not to trust you, you know? So that right there was a crazy experience. And if you can, just be with your baby as much as possible and just be there. You never know what could happen.
There's no reason that a mom should be, or a family should be separated. There's no reason that a mom should be separated from their baby if their baby does not need medical intervention, right? Even with medical intervention, a parent can be there. I get it if right after birth the mom has complications, they have to be separated, you know, that's a different story.
Exactly.
But everything can be done in the room with baby. Everything can be done in the room with baby. Obviously different hospitals have different traditions. Nurseries should no longer be existent, I think, in North America, where they kind of stop with that. And it's different if you requested, oh, can you take my baby? It's completely different.
Definitely.
Don't feel guilty if you requested for that. But yeah, as a healthcare provider, you can do everything in the room. You can listen to the baby's lungs on top, baby on top of mom. You can do a blood test when baby's breastfeeding. Like, there are so many things that you can do when baby is in the room with mom. And I think as healthcare providers, we have to think about this concept of baby is still attached to mom. Even though the umbilical cord is cut, there's this invisible umbilical cord that we're not able to see. And I think it's doing a disservice to them to separate. So yes, I'm sorry you went through that. Really, really sorry.
I appreciate it.
Because look, you still remember, and it's going to be with you forever. So I think, yeah, as healthcare providers, we have to also acknowledge that everything we do, they may remember forever.
Yeah, I remember your face. I remember everything.
I remember your name, your number.
I remember it. Like, that was very traumatic for me. Yeah. Moving on.
Yes.
From all the births that you've seen, how important is it to have support, your family, friends? And what difference have you seen from someone that doesn't have any or little to any, you know, versus someone that has like a whole village? Yeah. What's the difference?
Well, one, I believe it 100% takes a village. It's cliche to say, you know, you've heard it. It takes a village to raise a child, but I believe that it changes everything if you have one. Yeah. And I know some people just don't have that opportunity, unfortunately. But it's night and day. Night and day. It's having a village that is for you, not just people present that just want to be present for the baby, but who want to support you.
Yeah.
I see it night and day. I've seen moms who are alone, like let's say the partner situation didn't work out, or they're alone in this country, or they choose to be single parents. There are some that go through IVF, have donor eggs, and want to be the single parent. And I can't say that for all, but I see the emotional burden when they are in that process of labor and delivery and postpartum. Like when reality hits, it's very hard to witness, but all I can do is support and provide resources for these moms, you know. But you really see the emotional difference, the emotional burden on these moms,
especially like after they've given birth.
Yeah, for sure. But also during, like I've noticed that moms who do not have support are in more pain earlier on. That's just from my experience with the patients that I've had, the clients that I've had.
That makes sense though.
Because like you're more in distress. You don't have that extra set of hands to, you know, help soothe, you know, the contraction pain and soothe the emotional burden of, you know, going through the process of becoming a mom, because you are kind of shedding the womanhood that you knew that you are, to becoming a mother that you always, maybe not always dreamed about, but you kind of envisioned of what it would be like, but you're going through it and it's something that you've never felt before, right? And doing that alone, I can only imagine how they must feel, but all I can do is support. And
wow.
Right? So that's where your emotions are, like the hormonal shift is like the highest the first 2 weeks, so it's completely normal to be laughing and then the few seconds later be crying, like completely normal those first 2 weeks. But after the 2 weeks, if that continues and to the point where you don't want to take care of yourself, to the point where you're having some PTSD, you know, from your birth, and it's preventing you from taking care of baby, that's postpartum depression. So those who are more at risk are those who do not have that support and who have like a history of mental health already, and so on and so forth. But yes, definitely to those who are at risk, we provide the resources. Like I try my best to provide as many resources as possible. But in the public healthcare system, you know, as a nurse, I don't really follow with my patients. Like I'm there for a certain moment in time. So like it's like of course I can't attach myself to my patients, to all of them. I wish I could know how they're all doing today. But that's like the downside with the healthcare system, in the sense like you're just there for one part, and I don't really know what happens afterwards. And I wish I could see what happens afterward, to be able to be like, oh wait, have you looked into this? You know, have you looked into that? Like to just be able to provide, but I can't do it all, and that's why there's a whole healthcare network. But there are lacking parts in that. So
yeah, and that's why, for me, because I had 2 midwives, that's one of the reasons why I went that route. Yeah. Because they're there longer. It's very personal. Yeah. Like even right now, I know where one of them lives. She told me I can come. You know.
You can talk to her. It's direct.
Exactly, and it's more personal, and it's like you don't feel like you're left hanging, you know, without the answers that you truly need. You can, like, the meetings are not rushed. Yeah. You know, it's really, they don't really just see you as a patient. You know,
like a number.
Exactly. Yeah.
They see you as a human, as a person.
That's why I feel like choosing the best care provider is really important. And I feel like it also has a big impact on how you are. Yeah. Your what am I trying to say? Like, it has a big impact on your journey as a mother as well, because if you have a care provider that you feel like don't care about you, you're not being heard, I feel like that as well can impact you in different ways. Yeah. Especially negatively. So it's very interesting to hear how healthcare workers, I use that term, you know, either doulas, midwives, what else do they have?
Doctors,
It's so like crazy how much they impact us in a way.
They can change your life.
Exactly. Yeah. For the better and for the worse.
Yes, indeed.
Important is it to have a good partner? when, for the women? How important?
I think it's so important to let moms know, or before you become a mom, it's important who you choose as a partner. Life could be beautiful without a child, but more than anything, once you have a child, it changes that whole dynamic. It's like having a supportive partner is that village. Having a partner that is not supportive in the room is like being a single parent. That's like when I compare the single mom who has no support compared to the married, or she has a partner who's not implicated, who's not empathetic, it's like they're the same.
Yeah. And have you seen like firsthand where like in the room or whatnot where the husband is not really doing what he's
100%. I've seen some partners. Well, it depends. Like some cultures where they don't touch the woman if she's bleeding. Like I get that. But within those same cultures, I see them praying for their wives. Like there are different ways that men can support, or partners can support the ones in labor, the one who are giving birth. But yeah, some of them just don't. I guess they're so shocked, they're not prepared, they're not ready, and some maybe don't want to be parents. You know what I mean? And they feel they have other responsibilities to take care of.
Yeah.
But yeah, I've seen those dynamics where they just keep going out of the room, like, and when you feel that, it's like, okay, I feel as a healthcare professional, it's my duty to allow my patient or my client to feel supported as much as I can. And it's just being present more so in the room because I know she needs that more.
Okay.
But yeah.
So you don't pay focus to that. You just try your best to.
I try to be like, hey guys, you can talk nicer to each other. Like to that point, some fight in front of me, and I'm just like, all right, baby's not out yet.
Yeah.
But I'm not a marriage counselor. I'm not a relationship counselor. You know what I mean? Like as a nurse, there's so many hats that we can wear, but I gotta really like respect my role and respect boundaries and be like, just support her in that process. Yeah, like I'm not gonna judge them for picking a partner that I believe is not compatible.
Yeah.
But I can just focus on the present and help them the way that they need at that time. But yes, it changes.
And we're not talking about like the typical like, oh, shut up, like be quiet.
Yeah.
When you're like in the,
oh no,
we're not talking about that.
Not that when they're in labor and in pain and then they apologize after.
Yeah, exactly.
Like not that at all. Like you really see it's before.
The
like
neglect.
The neglect. It's sad because I seen it. It's not like saying one culture.
Yeah.
I see it in everything.
Okay.
Everything.
And those type of relationships, like during the postpartum phase, do you see it leading to postpartum depression?
Of course, a lot of them are at risk of postpartum depression. Those who have controlling partners are at risk of postpartum depression. Those who, I don't believe it's a risk, like confirmed risk if you don't have like a means of transportation, I think it's important to be able to communicate with others. If you are prevented from communicating with others from your partner, if you're prevented from leaving your home from your partner, like those are signs of abuse, domestic abuse. And I always let them know that there's help out there. If it's a red flag, it's always like there's help. You don't have to be stuck. Like you don't have to stay in that. But it's so tough because if you're depending on someone for all of your resources, it's so tough. Sorry, I can go on and on, but it's the reality. I see it more than you think.
Yeah.
More than you think.
Which is very sad.
Yeah.
So y'all gotta choose wisely.
Please.
Who you have a baby with.
Please do. But it goes deep. Sometimes it's not because you're choosing someone like that.
Exactly.
It's just it comes out later on, or insecurities within yourself. You don't think you deserve better. Like the moms, and it's deep, so I always try to empower them.
Does postpartum depression affect men?
Yes.
Yeah?
That is something I never forget to mention when I am teaching about postpartum depression. Postpartum depression affects the dads.
And what ways do you see it?
Postpartum depression affects the dads. Obviously, because that's 2 weeks post, right? Okay. But that's men. showcase emotionally differently from
Mhm,
from
for
moms,
sure.
so they can be very isolating
Okay.
or vocalize differently, you know, like raising their voice or anger, because not only is it, yes, an extra family member, but it's financial strain. It could be like
That's
just
true.
all types of responsibility that they feel on top of their shoulders. So they are at risk. I don't want to say equally at risk, but they are at an increased risk if there are factors that play into that. And so I always let them know that if there are signs, like, because the partners usually see the shift before you can acknowledge yourself, like, oh, I have postpartum depression, right? It's usually the people outside of you that are like, I think you need extra support. I always tell the moms, if you notice that he is not like himself, like on a regular basis, mention it to your OB doctor or your midwife, because they typically have the resources for the dads. And then vice versa. I always talk to the dads too. If you notice that your wife or your partner is not like herself, you know, dark thoughts, even if she's not opening up to you, mention it to her OB, mention it to her midwife, because they have resources, because you don't want it to be too late. So
we're going to touch on...
Sorry, it just got dark.
No, we're going to...
I laugh when I'm nervous, okay?
We both do. So, on the positive side, guys.
Yes.
What's the best way, once again, from your perspective, can a family friend support a mom? Like,
what's the best way a family friend can support a
during
mom?
pregnancy, especially postpartum? What's the best way?
By providing what the mom needs.
Okay.
The baby will be okay. In the sense, like, of course, if mom has feeding difficulties, unless the mother or the sister or the friend or the cousin has the skills or the experience with the breastfeeding and they're willing to help out, sure. But if they're just there to want to take the baby, then I would like keep those boundaries, because there's a difference between being a visitor and being a helper. You know, in that postpartum, if you're just going to visit, I'd wait. I'd wait for that invitation.
Yep, that's what I did.
Yeah, wait for that invitation, right? But if you want to help out, like provide meals, like that's a big one, I assume. Provide house help, you know, anything, right?
To what the mom is comfortable with.
To what the mom is comfortable with what she needs. And some moms are shy and don't want to vocalize what they need. But I think, you know, showing up with a meal, you know, and letting, you don't have to enter yourself, but just providing a meal and being like, I'm thinking of you. If you need anything, I'm here. Some people will take that as, okay, I won't message you if I need anything, but, you know, providing something and being like, you use it if you need it. And that's that. I think that's a great way to support moms, and providing mom baskets with, you know, mom gifts inside, because we give so many gifts to baby, but what about the mom? Like, she needs, you know, new sets of pajamas that fit, you know, like new pads, like new a new water bottle, like things that just make her feel special and feel loved and still feel important.
That's why, like, that viral thing that I see on Instagram, where like instead of having a baby shower, they have the what do you call it again?
It's not the baby sprinkle, but it's like the mom. I was just looking at that. Like,
I forgot what it's called.
Yes, it's like the nesting party.
Yes, the nesting party.
Yes, the nesting party. That's so great.
It is very much needed, and I feel like many of us need to adapt that, because after birth, you're kind of in survival mode if you don't have that village, if you don't have meals prepped, you know, and that the less preparation that you have, from what I've seen in my own personal experience, the more crazier you can become.
It's possible. There's some moms that come in and they're just like yes to everything. Meaning they're not prepared, but they trust you. Like they're just like, they just go with the flow. Whatever happens, happens. Like, they don't want to prepare because they're scared of the facts, the knowledge. You know how some people, when you know too much, it like kind of like how do I say, freezes you in a
Okay.
sense. There are some people who are like that, and that's fine. But I
For
do
sure.
believe there's value in knowledge, value in knowing your rights, because some people just say yes to everything, and it creates, you know, it takes away their rights. It takes away their power. You know, when you just don't really have that choice when you do. So,
Okay.
if that makes sense.
I'm trying to understand what you said.
Sorry, I'm using a lot of, in the sense like, you know how some people are just go with the flow.
Yeah, go with the flow. Nothing wrong with that.
There's nothing wrong with that, but it's important to know what you agree to and what you don't agree to. It's important to know the whys.
Okay, yeah.
You know, why are we doing this? Why are we monitoring your baby? You know, why are you pushing in that position? You know, why do you have to breastfeed your baby? You know, like what are the benefits to that? Like, I feel like a lot of moms, and I don't want to say all, of course, but there's some people, or younger moms, I should say, like that are very oblivious, and that kind of takes away from them gaining confidence and power within that experience. So anyways, as a healthcare professional, I always try to educate while I, you know, provide care, and to let them know that they have rights, they have a choice, you know, and kind of explain it to their learning level of their options.
And even like if you feel like you're, what you call it, your doctor, because you know some of them, they feel like that's really what they have. They don't really have midwives, like you said. It's really hard to find doulas. Sometimes they don't have the privilege of getting one. But the world we live in today, like you can go online, you have so many resources online that you can use and be able to advocate for yourself. Make sure your husband, your partner is educated as well.
Yeah, that's
and
important.
whoever is going to attend your birth, you know, is educated as well, because you just need to be prepared in that sense, instead of just putting all your trust in
and your healthcare team, and not saying that they're not capable or qualified to take care of you, because majority of the time they are.
Yes.
But there is power in knowing your rights.
Exactly.
So that's important.
All right.
And I just want to say, in terms of finding a doula, you can easily find doulas online. And if ever you're worried about costs, like sometimes insurance covers it, and there are some doulas that provide volunteer work. You know, like there is help out there.
Yes.
So do not second guess it.
And now, I feel like this is going to be a postpartum.
Maybe.
But I feel like it's needed.
Yeah, it is. Because sorry, I'm cutting you, but
no worries.
The labor, right? The labor and the delivery part, sometimes things go unplanned. Like you can plan so much of it, like you want to give birth at home, or you want to give birth in a certain position, but sometimes this baby has a different way of wanting things, right? Sometimes that cannot be planned, or that cannot go exactly as planned. But postpartum, you do have a little bit more of a control in terms of, of course, your baby, the way their hunger cues and all of that is different, and how you heal is different. But in terms of preparation afterwards, that can be improved.
You can do the work.
Yeah.
Yeah, you got to do the work.
Yeah.
And
like labor and delivery, yes, that's a moment, but then postpartum, it's like forever. You know, like your child, it will be connected with you forever. Not to put like that, like a lot on your shoulders, but it's like how that journey is, how you perceive yourself as a woman, as a mom, is so important, because your kids look up to you.
Yeah.
Whether you have a daughter or a son, they look up to you, right? And they depend on you. And it's just like, if you are an unhappy person because of the experience that you went through, with feeling that lack of support or having that lack of support, that impacts everything.
Everything and everyone around you, honestly. And at some point, you can't hide it. You can't hide it. It's like she said, it's going to show in your face, in your tone, everything.
Energy, the home, how the home is, right? So,
you feel like from the mothers that you were able to
take care of?
Yeah, take care of. Do you feel like they really understand like what they're in, like in terms of becoming a mother?
No. I don't think so.
Why?
Because of the expectation, right?
Mhm.
They expect to be, they expect an experience to go a certain way. Some are very open. They know that things can go very different or south, I should say. And they're very accepting of it. But some are, they have these expectations that they absolutely want it to go this way. And if it goes south, it's going to break them. You know, like you see that. And when that happens, it's like, it's so, because they're holding on to what they really want. That birth, that perfect birth to be. But some things are just out of your control. And I think there's this fear with C-sections, there's this fear with things getting medicalized. I mean, of course, everyone is different. I can't speak for different hospitals. I can't speak for other providers. But what's important is your health and your baby's. And that is what it really is in the hospital. If we see that baby's not cooperating in the sense like baby's not liking a certain type of medication that was needed to be given, XYZ, it's so tough to see a mom just give up in a process like that. So I try my best to always lift them up and let them know that it's okay.
So how does a mom give up?
Like in the sense that she has this idea in her head how something should go, but something happens that it goes south. So she just gives up her power.
Okay.
But I always try to help them understand that there is power in this different plan. You know, your plan is powerful, but other plans can be powerful too, and that's what I kind of try to elude or bring to light, because birth is not just vaginal with no medication. You know what I mean? Birth comes in many different colors. And I think although people are aware of that and some people scare people with stories of that nature, I think it's important to know that regardless what happens, there's support out there, regardless what happens throughout your labor, throughout your birth and postpartum. Like whatever happens, there's support. You don't have to go through it alone. I'm sorry. I'm really, really sorry to moms that feel like they were robbed of their experience. But there is help out there to help you understand that transition period that you went through, although traumatic possibly, it's okay.
Well said. And I feel like whatever that journey was for you was really meant for you. Like you were meant for that, you know, and to lean on. I'm gonna make it plain. To lean on God, if you believe on God, to bring you through, because that's literally your story. It will make you as a person if you really just educate yourself as well on different scenarios. You know, not just focus on that perfect birth that you want, perfect postpartum. It's just really see what can go in, you know, in different ways. So
it's something that you've probably never experienced before if it's a first-time mom. And if it's a second-time mom, I want to tell second-time moms, chill.
What do you mean?
In a sense, like, don't expect your baby to be exactly like the first. Don't expect your experience to be exactly like the first. This is a whole different experience. And I wanted to mention the word matrescence, which is basically the transition from womanhood to motherhood. And people think, okay, first-time mom, I have that transition. Second-time mom, you also have that transition.
You do.
Fifth-time mom, 10th-time mom, you have that transition from becoming a mom of none to a mom of one to a mom of three. You know, like it's a different phase, and it's beautiful. Also, it can feel very scary in the moment, I bet.
Definitely.
But it's worth to be celebrated, the highs and the lows. So,
That's true. So, what has this work taught you about life?
It's a big question. This work, in all honesty, has brought me closer to God. And what I mean by that is my spirituality and my purpose in understanding the beauty of life and seeing the value in it. Because seeing, you know, regardless of what's going on in the world, seeing newborns being born, it like gives hope and within the society that there's good out there, because I do believe that babies are born good, right? And of course, they can continue to be good if they're raised by great parents. And so it just brings this spark to life in the field that I am in. And I've learned so much. I've learned to be so patient and so discerning with people going through such a vulnerable and intimate time in their lives. And it's something that makes me excited for my own journey to come. And I'm like, oh, I'm preparing, but you can never be fully prepared, right?
Sure,
but I think it's great to see how important having a village is, whether it's one that you are biologically connected with or not. So yeah, I've learned so much, and I'm still learning. I'll continue to learn until the day that I die of this beautiful, beautiful process of life that not many get to experience.
I have to ask, do you plan on having a doula when you...
Definitely, 1,000%. If I could have like 10 doulas, that would be great.
Okay.
No, I definitely will have a doula. There's so many different types of doulas out there, so I think it's important to find the one that fits right for you.
Yes.
And yeah, I'm so excited for that process. And
so what type of doula are you?
Good question. I am a birth doula, also a postpartum doula. So I provide support throughout the pregnancy, education throughout the pregnancy, support during the labor, whether that's spiritual, emotional, physical, mental, and during the pushing period also, and postpartum, so immediately after, and also I do home visits afterwards. So that's pretty much it. And in terms of what do I do specifically, it's really what you need. And in terms of limitations, of course, if I'm being your doula, I will not be your nurse, in the sense, like, if we're in the hospital, I'm not doing your IV, I'm not, adjusting the baby monitor. Like, that's not my role. My role is there to be your support.
Yeah, why are you so passionate about this? What's your goal?
So the why is, there's some things that cannot be explained. You just know it, you just feel it, and that's my purpose. Maternal health care is just what I'm supposed to do. But in terms of my goal with this is to continue in that field, and I realize it's not limited to healthcare. Public healthcare settings, right? I love being a nurse, but there are quite many limitations in the field of it worldwide. So with everything that we discussed, you can kind of see where my heart guides me to, and sees that postpartum is such a underserved and undervalued point of life. And so I want to provide more postpartum care support for mamas out there, for families out there, because it's definitely needed.
And how can someone that's interested in having a doula, care, whatever phase they're in, in pregnancy, obviously, how can they reach you?
So you guys can reach me online with my full name that I guess you'll put down there, Bianca Kate-Augustin. But I'm kind of working on I am working on a project right now. It's live, but to launch early next year. It's called Numa Village. Numa standing for Nourish Ma, right? Like nourish her spiritually, physically, mentally, and emotionally. And it's more so to provide postpartum home services within that phase of life. So that with that program, or with that, should I say project, it'll be easier for moms to find doulas and find, let's say, physical therapists, find housekeepers. It's like a village.
Have all of that. Okay.
Yeah,
wow.
It's not just doulas. Because of course doulas can provide so much, but if you have a lot of extreme back pain and that doula is not, certified or have that experience with massage, and you want a massage therapist, you'll be easily able to find one on that platform. So that's what I'm kind of creating now, and finding doulas and other professionals in the postpartum world to provide that. So right now we're going to start in the Montreal and outskirt area, and then of course the goal is to expand Canada-wide, and who knows, North American-wide and worldwide. But yes, I think we need I want to plant that seed to impact the public healthcare system in any way that I can, because if I do that, then I've accomplished what I needed to do. And long term, I'd love to go back to Haiti.
Okay.
That is where it's calling me. Maybe to live, who knows, but to provide postpartum care support there.
Wow.
That country is not doing so well, but maternal health, that's the start. right? Like postpartum is the start. And any way that I can provide support over there, I would love to start like a nonprofit there too, for that population. So.
Yeah. So if y'all can follow and support, Numa Village,
Yes,
is
Numa
really
Village.
needed.
Yeah.
Like you said, I hope that it expands worldwide, God willing. I just don't see why people won't support, because it's needed.
Yeah.
Moms, we need it.
Yeah.
Moms, there's always gonna be moms.
Of course.
So it's a beautiful thing to see that this is in Montreal.
Yes.
And
I'm excited.
hopefully, it can go to Ottawa, and so that's where I am. So
that's the goal. Yes, that is the goal. The support is needed, even when you think you don't need it. Like if it's there, at least you can be like, I had it.
Exactly.
Instead of thinking that you don't need it, and then you don't have it when you need it.
Mm-hmm.
That makes sense.
Doulas, do they replace the husband when he's not? Let's say sometimes the husband gets tired.
Yes, if the husband can't be present, or if he needs to, take a nap, the doula can definitely take in that role of supporting you, but the doula will never be your man, your support. But she will complement, she will add on. I'm saying she, there are he doulas too out there, but they can provide that extra support that you need, but they'll fill in roles that you realize that really make a difference. So.
Okay. Yeah. After everything you've witnessed in regards to birth and supporting families on their journey of becoming parents, what has this work taught you about love?
That it's complicated. It's not a linear line, it's not like one word that defines it all. Love is expressed very differently, person to person, culture to culture, institution to institution. Unlike hospitals show love differently.
I hear you.
But yes, love is very, very different. And I've learned that you can't force someone to love you. Like, I want the best for my patient, but if she does not, want the best for herself, or doesn't see my understanding of something, I can't, I gotta let it be. You can't force it. So that's how I see love. And I am a person à la base, at the base, I love everyone, unless you show me differently. I'm joking. But in a sense, like there is so much hate in this world. It doesn't take a lot of energy to just have a smile. Showing a smile is showing love, just letting them know.
It ain't fake.
Yes, please. This is genuine.
Yeah.
But yes, it's just the way I present and I offer support and love. I kind of put two and two together.
So, what's a common fear that you see mothers, especially first-time moms, have going into motherhood? What's something that you see that they're really afraid of?
Well, afraid would be the pain, but the number one concern that I've witnessed is feeding their baby in terms of breastfeeding. A lot of, I blame Hollywood for, a lot of moms think it's just natural, pop the baby and it's going to be, a beautiful experience, no pain, it's going to be so easy for both sides. But the reality is, the first 2 weeks will be the toughest in terms of feeding your baby, in terms of finding what works for both of you. Because some moms have pain, your nipples are so sensitive, your baby's latched on properly, but it's just so overwhelming and so overstimulating for you,
Yeah.
There's that, and there's also the baby not latching properly, and it's causing blisters and XYZ. And I'm trying not to be political here. So yeah, breastfeeding or feeding your baby is one of the top concerns, because a mom always wants their baby to be fed and satisfied, and the mama bear in there comes out, and that is one thing that I've noticed concern-wise. But in terms of fear, it's more so pain. A lot of moms are afraid of not feeling pain, but being in too much pain, and I always say, we'll respect your limit, whatever it is. If you want pain relief at this point, that's okay. You are as strong as you are if you decide to get pain relieving medication
Exactly.
or not. It's actually stronger to know your limit and to know when you're ready for something else, you
Yeah.
know. So
And do you feel like there's a lot of moms that hyperfixate, is that the word? Hyperfixate
Yeah.
on like the way that they don't want epidural, they don't want this.
yeah.
Do you feel like it's a good thing?
I don't think it's a good thing to hyperfixate
Mhm.
and cause that unrealistic expectation, because those moms, I feel like they're at higher risk for depression, a postpartum depression, or postpartum anxiety, or postpartum mom guilt,
Okay.
because you know they absolutely want it to go this way and it doesn't go that way, or like something in it doesn't, and it can break them and it makes them feel like they don't have control, because a lot of moms want to feel like they have the control, especially since everything's changing, but there are some things that you just can't control, and it's okay. Whatever happens, you'll be okay. And that's what I kind of try to emphasize.
100%.
Like, whatever happens, you'll be okay. Like, having a plan is fine. Come prepared. It shows that you're educated and you know what you want, but that you are open to change the plan if something were to happen that is necessary to change.
Well said. We're going to talk about grief.
Oh, yes.
Okay?
Very important.
How would your support to someone that's grieving, that lost their child, how different is it versus someone that is celebrating life in terms of like their baby's there?
It's very different in the sense that when someone is grieving, there's no timeline to it, you know, in the sense that the care that you provide is slightly, it's, of course you're supporting them, but differently. You know, you got to read the room and see what they need. But I think it's important to allow moms and parents to know that it's not their fault, because it's something that they're gonna have that with them, hold that with them for the rest of their lives, and some will remember how they were treated, how they were talked to during that immediate time. Some people will forget, but I think what's important is to provide support, a listening ear, and the tonality of how you talk to them. You know, you can't bombard all this stuff to them. It's just being there, and someone can be grieving forever.
Yeah.
And no one is in a place to tell them they should get over it. You know, or never start a sentence with "at least."
Ooh.
That's a big one.
Okay.
That's a no-no. But yeah, I would always say, like, I would always not say, but just provide support in the way that they need it. Sometimes it's expected, you know what I mean? Like, they know beforehand it happens, and sometimes it happens unexpectedly. And obviously the response to both is very different.
Okay, in what way?
You can never fully prepare, but if you already knew of the passing, you're kind of processing through it. Obviously, it's a traumatic event, processing the birth of it too, but it's something that was on their mind prior, compared to the mom where it's just
sudden. And she came with the baby's bag, the clothes.
Yeah,
okay.
That's different. It's just. I don't want to say it's a deeper wound. It's you can't measure it, but I've seen the way that they react is different, you know. And regardless the way that they react, they have every right to react the way they need to. They can grieve however they want. They can cry however long they want. I think what they need to feel is just support at that time. It's not for us to judge how long they should stay in the hospital, how long they should stay indoors for. You know, it's up to them. But if ever, you know, you see where it's getting to a dark place, then that's when you really need to provide a bit more resources and find a way to work with her or work with him or the family to help them in their health, if that makes sense.
Yeah.
I don't want to say like help them get out of that place, but no, like you can grieve forever. But it's just letting them know that it will be okay.
And can someone like go through the grieving process but not go through postpartum depression? Or is it hand in hand? From
Yeah,
what you think?
it's tough. It puts them at increased risk for postpartum depression. I don't see how it can be separate.
Makes sense.
And grieving is part of the process. Grieving can be demonstrated through depression. It can be demonstrated through anger. You know, there's different emotions of it. But postpartum depression increase percentage. Like, I don't have a number, but definitely can increase. So they need even more support, you know, postpartum wise, because they are still bleeding. You know, they are still lactating. You know, like, we don't think about that.
Wow.
You know, and depending where they were in their journey, it can be quite traumatic facing your pregnancy clothes, facing the baby clothes, facing, you know, hearing a baby cry outside can be so triggering. And what about when you have your next child? You know, some people don't heal or haven't processed that first loss or whatever loss, how many losses they've had, and it increases their risk of postpartum depression. It increases their risk of, like, the PTSD when they have their child. You know, the moms who are super, super protective because they're scared something's going to happen to their child.
That's true.
It's a touchy, I don't want to say touchy, but it is a sensitive topic, but I think it needs to be talked about. I think we need to get comfortable with talking about death and dying and loss, because it happens way more than we think it is. A lot of people just don't talk about it, and that's when they isolate themselves. So,
have you witnessed a mom passing away? No, thank God.
Thank God. I thank God. I don't think I have seen one because I wasn't prepared for one, you know, but if I do happen to be a part of that unexpected event, I know that whatever I've experienced in the past, with the support that I've provided, with everything that I've learned, that I will be equipped to support the family members and, you know, needed during that time. But it's something that we do. It's something we try to avoid completely, prevent. Nobody wants that to happen, but sometimes things happen that are out of our control. And I feel for all the families that have lost wonderful women unexpectedly. And if you are a child of a mother that passed away during childbirth or postpartum wise, like, my heart grieves with you, because it is something that lives with you forever. And
you don't really think it's going to happen
until it happens. Sometimes there are things that you out of your control, you can't prevent. Some things are just happens, and it's just that.
Okay, last one.
Yes.
I hope. If you can speak to a new mom, soon-to-be mom, or a mom that's even experienced, what would you tell them?
Like I said before, you're a great mom. Even while pregnant, I believe that you become a mom as soon as you're pregnant. You know, like, because if you lose that baby, you still went through that process. It's just a different chapter of life. I just want them to know that there's help out there as a new mom. A lot of new moms want to do things on their own, and that's okay, but know that there's help out there, and there's no shame.
Exactly.
No shame in getting those helping hands.
You heard it. So that will wrap up this conversation. Thank you for listening, everyone. We hope that you were able to get some value from this conversation. All right. Thank you for coming, Bianca.
Thank you so much, Anisha. I really appreciate it.
No worries. Oh my gosh, we finally did it.
All right. Yay.